Large areas of China battled damage caused by the worst flooding to hit the country in decades on Saturday, as a levee was repaired and more people were rescued. Many cities and provinces have now declared red alerts, including the central city of Wuhan, the southern city of Nanjing, and 3 provinces in the eastern and southeastern parts of the country. A levee in one of China's largest freshwater lakes, located in the south of the country, was repaired on Saturday after it burst a week ago. According to state media, one of the 3 dams in Poyang Lake in Jiangxi province burst due to heavy torrential rain and accumulated floodwater. Water gushed out of the opening, affecting more than 8,000 people in 15 villages nearby. The floods have also hurt economic activity in other parts of China, especially in construction and demand for steel and cement, according to analysts, suggesting some loss of momentum after a stronger than expected bounce in the second quarter. China's banking and insurance regulator also on Saturday announced measures to further increase credit and lending support and offer insurance protection for areas that suffered from the recent floods.
Streets of Anshi City are submerged in water after overnight heavy rain. Floodwaters are 2 to 3 meters deep in downtown areas. Homes at low-lying areas are inundated, with some residents trapped. Rescue teams are using rubber boats to save them. In another residential community, around 80 residents are trapped. Rescuers have to conduct a house-to-house search. Floods in the city's commercial streets have receded, and most business owners have come back to save their goods.
The most urgent thing is to help downtown merchants save their inventory. Then we will disinfect the flood-hit areas, since we're still fighting the coronavirus.
Local authorities in Anshi City have raised the emergency response to the highest level. But risks still remain, as more torrential rain is expected in the coming days. Chen Xiaoshu, CGTN.
Rescuers help people pack their belongings. The water level around their homes has reached dangerously high levels and is still rising. They've been told they must leave quickly, but nobody knows how long they'll be gone for or what will be left of their homes when they return. Local emergency departments across China's eastern province of Jiangxi are ramping up their response in preparation for an influx of people. Staff are taking delivery of thousands of tents, beds, blankets and towels.
I have received 50 folding beds and 50 blankets. So far, people from 10 villages have been relocated. Once the supplies arrive at our town, we distribute them to villages immediately.
Many of those whose homes have been evacuated live near Poyang Lake, the largest freshwater lake in China. Torrential rain has caused water levels to rise rapidly, and the authorities say they're expecting severe flooding in the coming days.
The high water level of Poyang Lake is expected to remain for another 20 days. The current priority for our flood control work is to enhance patrol forces for round-the-clock monitoring against risks along the embankments and be prepared with contingency plans in case of any emergency.
There's been torrential rain and flooding in central China too. In neighbouring Hubei province, towns are submerged in meters of polluted floodwater. Across China, the extent of the damage, the economic loss and the number of lives lost is still being counted. The Chinese government's allocated $85 million of relief funds to 4 provinces and 1 municipality battling against floods. Victoria Gatenby, Al Jazeera.
Up to 300 million yuan, that's about $43 million. Meanwhile, we've learned that armed forces and emergency workers have evacuated about 12,000 residents to relocation sites. And from July 10th, when the water began to recede, local authorities now stepped up relief and reconstruction efforts. As more, we can see residents this week have made their way back home. And prior to that, excavators joined over 1,000 personnel to clean out mud and waste. And rounds of disinfection works were carried out across the town. And the government has distributed materials worth 1.5 million yuan to each affected household. And agricultural and forestry experts also have been sent to reclamation works and maintenance on broken houses, roads, and bridges. Like Shijiaotan here, many townships, particularly villages hard hit by the torrential downpour in the Poyang Lake regions, are faced with infrastructure and financial challenges.
More than 4 months after the coronavirus first exploded in the United States, several states are seeing new spikes in cases. Texas reported more than 10,000 new cases for the 4th day in a row on Friday. The state has given public schools the okay to remain closed in the fall. The virus has killed more than 3,800 people in Texas. Florida also added more than 10,000 new cases to its tally. Parts of the state have issued mandatory curfews to get people off the streets. The jump in cases has convinced retail chains like Lowe's and Home Depot to join a growing list of companies requiring customers to wear face masks in their stores nationwide. For more on all of this, I am joined by Dr. Amesh Adalja. He's an infectious disease expert as well as a senior scholar at Johns Hopkins University Bloomberg School of Public Health. Dr. Adalja, how can officials in these states seeing a spike in new cases address the issue and start to get some control over the virus, especially when public health experts are saying one thing and then local officials, state officials, and national officials might be saying something else?
This has really been the story of the entire pandemic, conflicting information from different levels of government that have made it very hard, if you're a member of the public, to know who to believe, who to trust, and seeing shifting guidance from different places. And that's not how you should manage an infectious disease emergency. What people should be doing is listening to public health authorities, because they are the ones with the expertise on how the disease is spreading in their area and what activities are promoting spread and which activities are relatively safer. And that being said, you're going to see lots of businesses require face coverings to come in, because this is being seen as increasingly as the currency for moving forward. And it is something that if there are people that are sick that are going out, and clearly they are, or we wouldn't be getting this type of spread in some states, a face covering, not just a face mask, but even a face shield, may provide some benefit for preventing the spread and getting this under control.
Well, earlier this week, the Trump administration instructed hospitals to no longer report daily COVID-19 data to the Centers for Disease Control. Instead, the information is now supposed to be sent directly to a database in Washington. Tell us how you feel about that news, and do you have any concerns about this information bypassing the CDC?
We know that the CDC is the premier public health agency in the country, probably even the world, and that it's their guidance that is very, very critical to managing any kind of infectious disease emergency. But what we've seen from the very beginning of this pandemic is a marginalization of the CDC, where CDC experts are increasingly being forced to think about whether their guidance is going to be something that conflicts with a narrative from the White House versus whether it actually is reflective of reality. And I think that's a poisonous atmosphere, and it's really further evidence, this new move, of how the CDC has become sidelined and isn't able to do its job. And I think this is something that we're going to see the consequences for a long time.
Well, I also want to ask you a little bit about testing for COVID-19. Many of the available tests can take several days to produce a result. We heard the governor of Texas speaking out against this problem today. How does the delay affect our ability to actually get the virus under control?
It actually makes it almost impossible to get it under control.
The pandemic didn't change the daily toil of life as a farm worker. It changed how many are seen. Undocumented became essential. In Immokalee, Florida, we met Gloria Carrera in April. Here you have to do what it takes to make a living, she said. For her, it was picking tomatoes to support her 2 children until the pandemic hit. The truth is you leave with fear that you'll come back home sick, fear that you could make your children, your family sick. Gloria stopped working. Most kept going, boarding buses to the fields. Some growers added hand-washing stations, but seeing that testing for COVID-19 lagged behind here, the coalition of Immokalee workers started ringing the alarm.
Because if you think about it, about the virus as a wildfire, we are dry tinder in a way.
This is what Collier County, where Immokalee is located, looks like now, a hotspot on Florida's COVID-19 map. We returned in June.
One organization known for helping vulnerable populations around the globe, Doctors Without Borders, is actually here in Immokalee. You can see their volunteers there in the white vests.
Susan Doyle says the organization recognized the need here.
They're not able to work from home, so they have to go to work every day. They're often living in quite crowded housing, using group transport to and from work. And it's particularly difficult to isolate for this population, so that's also very scary for them.
Gloria.
We checked in with Gloria.
So you went back to work for a few days, regresó a trabajar unos días, y dijo que ya no porque ya no había precaución, not enough precautions.
Traté de mejor proteger a mis hijos. Dije, no, me protejo yo y protejo a mis hijos.
You have to protect you in order to protect your children.
Gloria has diabetes. Her partner's income is just enough to cover the rent.
No tienen acceso al desempleo, right? You have no access to unemployment.
No tenemos eso.
You have no health insurance, no seguros.
No seguro ni nada de eso.
Y otra entrada no hay. What's the other income?
No hay otra entrada.
For her and so many others here, the concern is on 2 fronts: home and the home they left behind. I start thinking about my mother, she says. She's also diabetic.
¿A dónde vive ella? Where does she live?
En México.
Mexico, a country in the throes of the outbreak. Fears over what the virus could unleash upon Latin America first materialized here, Ecuador. It's believed a woman returning from Spain imported the virus. Within weeks, deaths overwhelmed the largest city, Guayaquil. Corpses were left on the street. At least 3,000 Ecuadorians have died, including colleagues of Dr. Luis Yepes, who we spoke with in April. We have to wait to mourn another time, he says. What we have to do is face the situation head on. As the virus spread throughout Latin America, the region's severe inequalities, poor social safety net, and fragile infrastructure were laid bare. Nowhere has that proven more true than the region's largest country, Brazil. President Jair Bolsonaro has not only refused to enact lockdowns, he has defied social distancing guidelines and recently tested positive himself. While Brazil's poorest neighborhoods, or favelas, were left to try to disinfect themselves. It's now the world's second worst outbreak, behind only the United States.
All right, so the coronavirus pandemic is really ravaging South Africa as cases there continue to surge. There's more than 300,000 confirmed infections, while nearly 4,500 people have died there. The government is ramping up its response by imposing curfews and banning alcohol sales. South Africa's president warns of the gravest crisis in the history of our democracy.
But now, the surge in infections that we had been advised by our medical experts would come has now arrived. The storm is upon us. More than 250,000 South Africans have been infected with coronavirus, and we know that many more infections have gone undetected.
Many hospitals are being forced to turn away patients because of overcrowding and lack of healthcare workers, and some South Africans say they are struggling to get tested and treated.
This is terrible. Sick people are getting sicker. Some are dying on their legs, you know. It's hurting. It's hurting really.
I'm very, very worried. I think everyone should. It's something that is challenging a human life. It's something that can kill, that has a potential to kill maybe half of the population in the world.
For more on this, let's bring in CBS News correspondent Deborah Pattas. She's joining us now from Johannesburg. Deborah, this is so heartbreaking. You know, I had been planning, my family and I, to come back to South Africa in September near Durban for another safari, and now we've put that on hold because of the cases not just here in the United States, but also in South Africa. So what is the latest there as cases continue to surge?
Well, certainly, I don't think you and your family will be traveling here in September because this country is only expected to peak in September. It was really hoped that the coronavirus would tread lightly on the African continent. It was slow to arrive here, but now it's here with a vengeance. And as you reported, nearly half of all cases on the African continent are here in South Africa, over 300,000, with nearly 4,500 people having died from the virus. And South Africa's President Cyril Ramaphosa warning there in that soundbite that you played that the COVID storm is engulfing this country, and it certainly is stretching the resolve and the resources of South Africa to their absolute limits. The cases are being seen multiplying across the country with a kind of ruthless efficiency. Now, South Africa went into a very hard lockdown at the end of March when the first infections arrived in this country, and that helped to some extent prevent the virus from spreading. But as restrictions have been loosened, and they've had to because of the huge economic impact of the lockdown, we've seen that virus spreading across the country and those cases rising, and different provinces are dealing with it differently because not everybody has the same resources. It was hoped that that early lockdown would actually help the health systems, give them time to prepare for this pandemic. In some areas that has happened, but in the poorer parts of the country, it's unlikely that that has happened at all.
Deborah, can you dig a little bit more into that? Because as we've learned here in this country, the concern over the virus is directly linked to the healthcare system's capacity to deal with the influx of new patients. You know, what is happening in South Africa? We're hearing, horrible stories about hospitals having to turn people away because they simply don't have a place for them.
It really depends on your geography, Anne-Marie, and I think that's a very important question. President Cyril Ramaphosa of South Africa spoke of this COVID storm. We're all in the same storm, but we have different boats battling that storm. Some people have fancy cruise liners. So, for example, here in Gauteng, the richest province in the country, the economic hub of South Africa, hospitals by and large are better resourced. There's still a shortage. People are concerned about a lack of oxygen, the shortage of protective gear and other equipment needed to fight this pandemic. And as it gets worse, that's going to become more of a problem. But there are also a lot more hospitals here gear so they can shed the load. So you haven't seen people being turned away from hospitals in Gauteng. But then you go to poorer parts of the country like the Eastern Cape, the poorest province in South Africa, and experts were always warning that if the coronavirus hit this continent, it would decimate already fragile health systems. Well, that's what you're seeing at a place like the Eastern Cape. The Eastern Cape has been beleaguered for many years. It's come through over a decade of corruption and mismanagement under a previous administration. And what the coronavirus is really doing is exposing the rot that has been there all along. So at a hospital like Livingston Hospital in Port Elizabeth, the capital there, what you are seeing is waste, medical waste overflowing, rats feeding on that medical waste, a huge shortage of equipment, people making makeshift protective gear. Even things like washing machines are broken down, so staff are unable to wash sheets and provide clean sheets. And of course, a huge shortage of staff and having to turn people away and no other places for those people to go to. Gravediggers have been told to prepare hundreds, dozens of graves because the number of deaths is rising steadily in that particular province. People dying lonely deaths in hospitals. We've seen that all around the world, and then being buried quietly and alone, families not being allowed to go to the grave sites. And crippling that as well is the twin pandemic of hunger in this country. A recent survey showed that in 1 month, nearly 50% of South Africans ran out of food. We are seeing desperate food shortages and hunger and malnutrition in places that we've never seen it before in South Africa. It's very worrying indeed, Anne-Marie.
You know, Deborah, it's so heartbreaking to hear you describe those conditions. And I guess my one hope is that, as you know, the rest of the world, you know, in years past, the United States led the world in combating infectious diseases. There is no other country right now who is taking their lead from the United States, with perhaps the exception of Brazil. I wonder what it is like at the government level in South Africa in terms of figuring out a way to combat this, the spread of COVID-19, both at the federal level and at the local level. Is there a sense that there needs to be something done and the leaders are just trying to figure that out? Because you've seen that happen in France, you've seen Italy do that. The United States has not yet caught up to that notion. I wonder what it's like in South Africa.
It's a good question, Vlad. Look, we have a president who is very concerned about this country, Cyril Ramaphosa, in this country, and it is mandatory to wear a mask. You get fined. You can even go to jail for not wearing a mask. You cannot enter any public place without a mask. You cannot be outside. You cannot run. You cannot jog. You cannot do exercise. You cannot go into any public transport if you are not wearing a mask, and there is hand sanitizer everywhere you go. So just on that basic level, the sort of 3 pillars, social distancing, mask wearing, and hand sanitization is constantly being drummed into South Africans. It's not being practiced everywhere because simply in poorer areas where people are on top of each other, it is very, very difficult to not only police that, but to ensure that it actually happens. But certainly there is a concerted effort. This country's also learned lessons from other countries. So one of the peculiar anomalies about South Africa is, despite having a high number of infections, we have a relatively low death toll compared to global statistics. In this country, there are only just under 4,500 people who have died from COVID. Now, some of the reason for that could be underreporting, and yes, there is concern about that. I spoke to the head of trauma in South Africa's main hospital, and she said, yes, there is underreporting of deaths, possibly, but there's only so many dead bodies that you can hide. We've learned in this country from other countries about how to treat critically ill patients. Oxygen is the preferred method in this country before ventilation, and that is helping a lot of critically ill patients to survive this disease. There is also interest in the BCG vaccine, which is given, it's mandatory in this country. It's given to children to prevent TB, another big killer in South Africa, coupled with HIV/AIDS. And there are studies being done around the globe Globe as to the fact that possibly this vaccine provides a relative amount of immunity. It could at least lessen the effects of the disease if you do manage to contract COVID-19. So these things are helping to hopefully contribute. It's still, the jury's still out. It's still early on. The peak is only, as I said, in September. But certainly they are having some kind of effect, and there is leadership.
In Beirut, desperation is in the air.
أنا راح أموت راح مخنوقة شغل ما في بدك تتدين غصبا عنك لطعمي الأولاد أجار الكهرباء روح على شركة الكهرباء وشوف أعطيك وصل 1,500,000 صار علي.
Inflation has skyrocketed in Lebanon, leaving swathes of the population simply unable to meet the cost of daily life. Every day people pack into this charity food and medicine distribution point.
عدد طلبات ببنين تقريبا زاد بدك تقولي تريبل او مينيموم كمان لانه تعرضنا لكذا مشكله بلبنان هي الكورونا بلشنا رجعنا صار في ثوره 17 تشرين رجعنا عندنا المشكله الاقتصاديه حاليا لعب بسعر الليره والدولار.
Many here never imagined they'd be relying on handouts to survive, like Haifa, whose son is a teacher.
لا أول مرة أنا متغير 100% يعني كنا عايشين بشي وصرنا بشي والله فجأة هيك انعدمنا ما بقى في شي عنا.
This charity is handing out more than 10,000 food parcels a month. Many now to middle-class households. Ali just lost his job in a furniture shop and is struggling to feed his 3 children.
هيدا حقه 50,000 هيدا 25,000.
The minimum wage in Lebanon is now the equivalent of $100 a month.
أنا بالقبل أحلى أكل باكل وبشرب وكل شيء منيح. ولادي بمدرسة خاصة هلا بالرسمي إن شاء الله نقدر نحطهم. تاخذ لتات طعم اولاد انا عندي 3 اولاد بدي طعميهم تكرم مني بدنا نعيش ما بقى في شيء هاي بلدنا راحت.
Lebanon used to be known as the Switzerland of the Middle East, but now millions of people here are struggling to get enough to eat. The World Food Programme and the government here estimate that around half the population could be below the poverty line by the end of 2020.
China is vowing retaliation after President Trump signed legislation sanctioning officials and banks earlier this week. He also signed an executive order ending Hong Kong's preferential trade status. The U.S. made the change after Beijing imposed a controversial new national security law on Hong Kong. It includes criminal penalties for what China's government calls secession, subversion, terrorist activities, and collusion with foreign or external forces to endanger national security. Beijing says the legislation will make the city safer, but critics argue it's an ill-concealed effort to curb freedoms previously enjoyed by the residents of Hong Kong. To talk more about how it's impacting life in the city, we want to bring in Mary Hui. She's a reporter at Quartz, and she's been following the latest developments from Hong Kong. Mary, it's good to have you. It's been just over 2 weeks since China implemented this national security law. How are the people in Hong Kong reacting to the implementation of the legislation, given that there's also been a recent uptick in infections of COVID-19?
Yeah, there's certainly a mix of emotions, I think. The very first day after the national security law was signed into effect, people did take to the streets to protest as much as they could, despite a heavy police presence. But in the weeks since, what we've seen is an increasing amount of control over all aspects of life in Hong Kong. Protest slogans have been banned. The education minister has said that a protest anthem that has been kind of at the center of the protest movement is to be banned from schools because it is subversive in intent. And at the same time, a lot of these so-called Lenin walls, which are these colorful walls that pro-protest establishments and businesses put up in their shops, these colorful displays of pro-protest, pro-democracy, photos and messages, those have all been scrubbed and taken down because the government has insinuated that those may be in breach of the national security law as well. So overall, what we're seeing is this consolidation of control under the auspices of this national security law. And people are still right now, first of all, have a lot of questions about how the law will be enforced. And second of all, where the lines actually are to be drawn, because as you said earlier, this law is very vaguely written and the crimes are very vaguely defined.